All right, so we talked about some different types of therapy so far, and now we're going to talk about therapies that grew out of behaviorism, of the learning approach, the stuff we talked about in earlier chapters. Remember we talked about classical conditioning, operant conditioning? Well, those have led to the development of different types of therapies. So behavior therapy attempts to change behaviors associated with psychological distress using principles of learning, using learning principles like conditioning. So you have some therapies that are based on classical conditioning. That's the stuff we learned about with Pavlov's dogs and the unconditioned stimulus being paired with a neutral stimulus, and eventually you get a conditioned response. All right, you don't have to go and relearn Pavlov's dogs, but let's talk about some of the therapies that are based on classical conditioning. All right, so a lot of these, well, not all of these, but many of these have been applied to anxiety disorders, particularly phobias. And so one type of therapy is exposure therapy. The idea with exposure therapy is somebody has a phobia. When you have a phobia, you often avoid the thing that you fear. Well, when you avoid the thing that you fear, it's reinforcing. You might be thinking, well, how so? Remember, there's negative reinforcement. And negative reinforcement does often confuse students, because negative reinforcement is where you strengthen a behavior by taking something away. So what behavior would you be strengthening with avoidance? Well, avoidance. You are strengthening not going anywhere near the thing that you fear. How are you strengthening it? Well, because you either feel relief, like, oh, I avoided that. I didn't have to experience. Whew. Let's say you fear dogs. You have a phobia of dogs. So you purposely don't go down a certain block because you know there's a dog in one of the yards. And you feel better. You're like, whew, I didn't do that. Even you may not have actually been in danger from that dog, but you feel like, I averted danger. I avoided danger. I am safe. I feel safe and relaxed and calm. These are good feelings. What are they being associated with? Avoiding that block, avoiding that dog. So avoidance can be maintained. It can be reinforced with negative reinforcement. So exposure therapy, you got to redo some different conditioning. And so the idea with exposure therapy is the person is exposed to the thing that they fear. How might this be effective? If you are exposed to the thing that you fear and you get to pair that experience with an okay experience, a calm experience, even a pleasant experience, it undoes some of that previous conditioning. So you might have the person slowly be introduced to a dog. You might work up to them petting the dog. There are different ways that we can do this type of therapy. One option is something called flooding, where it's just all at once. Like maybe the person is scared of flying, and they're like, all right, come on, we're going on the plane right now. Well, no, I'm not ready for that. Or they're scared of a certain animal, and they turn around and like, here's the animal. You're gonna see. And the thing is, they get to see, oh, okay, well, I'm terrified at first, but now I've calmed down and I'm okay, I'm safe. The idea is they get to see that they face the thing that they fear and they are indeed safe. And I'm giving the simplified version of everything, of course. You can also do a slow, gradual approach with something called systematic desensitization. This involves steps. So first you have to create a fear hierarchy. It's like a ranking of things that you fear, things that you would fear most, and they have you work through the fear hierarchy. So you start off with something you don't fear that much. So maybe in terms of the person with the dog phobia, like maybe they don't fear pictures of dogs, or they don't fear a stuffed dog, or they don't fear looking at a dog from 20 feet away. And they're like, all right, let's start there. And so they get to experience that. Then they have to work up the things that they ranked on their fear hierarchy. Okay, so you said that you'd be more scared of actually being 1 foot away from a dog. So then they have to do that. Actually petting the dog. You know, the different things they work up to it. So eventually they're at the top of their fear hierarchy, and they get to learn like, oh, I am okay. And they also learn things like some breathing techniques, some relaxation, muscle relaxation techniques, so that they can be in a calm state, and that is what's associated with the fear object. All right. And the book, my textbook that I use for class, it goes into some additional things, but those are the things I'm focusing on for class. Now, you also have some therapies that are based on operant conditioning. Operant conditioning, where you manipulate the consequences of behavior. So things like reinforcement and punishment are controlled with these types of therapies. And so the one that I'm going to focus on, there are multiple ones listed in the book that I use, but I'm going to focus on the token economy system, which I did talk about a little bit previously in the learning chapter. With the token economy system, you can earn tangible reinforcers of some sort. I'm looking around. Oh, here we go. So maybe what if every time I exhibited a desirable behavior, someone gave me a binder clip? And you might be like, why do you want a binder clip? Well, what if there's a sign up in the school, the hospital, the clinic where I'm at? What if there's a sign up that says if you have 10 binder clips, you can trade them in for a soda? And I like soda. I want a soda. All right. The idea with the token economy system is you get to earn tangible reinforcers. So I worked in a place where they had little poker chips that you could earn. The kids would have a jar of these poker chips, and once they had so many, they can trade them in for prizes. They called them prizes. We would consider them reinforcement. And people also, they can have points charts, sticker charts, star charts in schools and things like that. They are often set up as token economy systems. So you earn tokens. All right, got an error message. I'm not sure where I got cut off, but so with tokens, you earn tokens. Tokens can be traded in for some reward, and hopefully that will lead to an increase in desirable behaviors. And sometimes the token economy system is set up where you lose tokens for undesirable, maladaptive behaviors. So hopefully, if you were punished by losing tokens, losing that option for reward, that should also reduce the undesirable behaviors. All right, so those are your major behavioral approaches. All right, the next video will be about cognitive therapies.